This is Dr. Ben Weston now of the County Health Department. Let's listen.
We've seen a major increase in our daily testing in the county, in particular with the 2 National Guard sites. These 2 sites will be closed on Sunday. They need a day off, and will reopen for another week starting on Monday, again through Saturday. The hours will be slightly adjusted. It'll be 11 a.m. to 8 p.m., and this is to ensure that we're able to cover essential workers that may have an easier time coming in the evening. They'll have the same high-level capacity as they do now. And while these sites do not make appointments and are first come, first serve, also a reminder that if you're symptomatic, you can call 211 and be connected with a health system or community health center site that can provide you with an appointment for a quick test, and that'll be regardless of income, insurance, or immigration status. As our county dashboard has grown and expanded beyond information, beyond basic information, to more in-depth view of trends, effects, and response of our community to the COVID-19 pandemic, we've been looking to have a view that quickly summarizes the status of several key indicators for the county. I'll pull it up now. You can see we have a new tab down here in the lower right for key indicators. So this is now live on our public dashboard that you can see here. The key indicators include tracking trends in cases, testing capacity, healthcare impact, personal protective equipment supply, and tracing ability. So each of these has been given a green, yellow, or red category indicating excellent, caution, or concern. And for now, we'll update these elements on a twice-weekly basis, Mondays and Thursdays, to provide a better understanding of the status of key indicators and kind of a summary of what's going on with the dashboard with all the different elements. So these are based on a combination of Badger bounce back criteria, Medical College of Wisconsin identified metrics, Wisconsin Hospital Association priorities, and other elements deemed as locally important by our medical and public health professionals. So we hope that this red, yellow, green indicator tab, in addition to the dashboard in general, will help to inform both our public as well as stakeholders of how our county is progressing as we move forward in a measured way to pull back stay-at-home orders and begin to open back up. So with summer approaching and businesses starting to open, it certainly can feel at times like we're getting to the point where we can put COVID-19 behind us and get back to normal. Unfortunately, we know that this is not quite the case. We've seen in neighborhood and communities and other states that the pulling back of stay-at-home inevitably leads to an increase, in many cases a very substantial increase, in the burden of disease. While the stay-at-home orders may have changed this week, the fact remains that COVID-19 is still very much in our community.
You've been watching.
Will be for likely at least a year to come. We'll continue to be vigilant as a community in carefully monitoring key criteria to understand how COVID-19 is affecting us now and in the future. We have a long road ahead of us, but we're becoming more and more prepared by the day and must be measured, cautious, and I think with the help of these indicators, informed as we move forward. Thank you and stay safe, and I will hand it back to Catherine.
Thank you, Dr. Weston. Next, we have Dr. Bhattacharya. You might be, oh, you're on mute.
Okay, I got it. So thank you very much for the opportunity to talk. And I'll start where Dr. Weston ended, basically that the Moving Milwaukee Forward plan that we are talking about, that we have to be still mindful that COVID-19 is with us, and every municipality in the Milwaukee County is still seeing it. So Moving Milwaukee Forward orders put together by the local health department following the CDC guideline is basically continuing to practicing the physical distance, good health and hygiene, wearing masks where it's critically needed. Of course, we also looked into the economic need for the Wisconsin and the Wisconsinites. So City of Milwaukee Health Department, as you know, is actively ensuring that up-to-date information to be provided to its residents, business owners, and our intention is to make sure everyone understands what is allowed and what is the safe business practices are. Now with the new order, this is very well measured and phased approach in space. So this plan allows us to outline the measures needed as soon as we focus on the importance of the continuation and resumption of the business and activities for the sectors, for our economy, and as well as to operate physical distancing and the protective measures that's critically needed for the safe practices. As you know, that this is a 2 long months and over that everyone is really anxiously waiting. But unfortunately, for our health and the safety, we cannot just flip the switch overnight and go back to normal. So reopening our economy will take time, and it's critical that we don't revert back to where we started. Means go back to our previous practices. So we have to be very, very mindful and take the phased approach that we have taken in issuing this order. So Milwaukee County has made good progress in slowing down the spread of the disease, COVID-19. And we cannot just suddenly give up, as there is a high risk and high likelihood that we can see the spikes again. So we have to be very mindful about it. Like as we are seeing, the weather is getting better, and people definitely will take the advantage of it. But please be mindful that COVID-19 is with us, and maintain the physical distancing, wash your hands when you get back home, as well as maintain your mask and protection for the face, so that we make sure that we continue our good health hygiene and the public health practices. I'll stop now, and hopefully there will be some questions I can respond to. Thank you.
Thank you. Next, we have Inspector Tlaib, and she will be joining us to talk about National Police Week. Just as a reminder, she is here to talk about National Police Week and honor our law enforcement. If you have any other additional questions for the Law Enforcement Division, we ask that you ask those offline or following the brief. Thank you very much. And Inspector Tlaib, woo! It's Friday.
It is. Thank you very much for having me. Like you said, this week is Law Enforcement Memorial Week, and it's a difficult time for us this year, as it was last year. We were hoping to have a group of us in Washington, D.C. during the Law Enforcement Memorial Week so we could honor Officer Matthew Rittner's sacrifice, his life. But unfortunately, with everything going on, that was not possible. So he has joined over 22,000 other names on the wall at the memorial for all of those who have really made the ultimate sacrifice for their cities. So this week on Wednesday, the police department and the members were able to watch a virtual, actually candlelight vigil that was held in Washington, D.C., where all of the names of the officers from 2019 were read off. Then at midnight, we were able to have actually one of our retired Milwaukee police members along with our honor guard down here at midnight playing Amazing Grace on his bagpipes, just to be able to show, our respect and our gratitude for those officers who have died in the line of duty. So we greatly much appreciate all of the support that we were able to receive from all of our community partners and members. And as a law enforcement officer, I ask the public whenever they see an officer just to, say thank you, show your appreciation for the work that they do. And it's a very selfless line of work. It's very rewarding as well. But they are out there every day doing everything that they can to protect our city. Even in this pandemic where people were able to stay home, even though many of us I know didn't want to do that, but our officers were still out on the line and doing what they needed to do. So I greatly appreciate it. I show appreciation for my fellow officers, and I thank them for everything that they've done.
Thank you very much. We appreciate it as well. We will have Mayor Barrett joining us. I don't see him on the line just yet. So as we wait for Mayor Barrett, we can move to questioning. Rebecca Clough from TMJ4, I know you had a question. If you wanted to turn your camera on and go off mute and ask our guest your question.
My question was originally for Mayor Barrett, but it could be for Dr. Weston as well. His reaction to Cudahy opening up tonight, and what would his advice be for the community as that safer at home order ends?
Sure, I can start with that, and then perhaps when Mayor Barrett comes on, he can expand as well. I think what is key as we open up is to do it in a measured way. We've seen and discussed time and time again that when communities open up too fast, when they get back to business as normal too fast, they see a spike in cases. And unfortunately, they also see a spike in hospitalizations and a spike in deaths. Part of opening up in a measured way is what the government puts out, the orders that are put in place. The other part is community education and individual education. And so I think for the community members of, there's lots of communities right now in Wisconsin with no orders in place. And so for members of any of those communities, I think considering individual responsibility, considering risks and benefits to the community, and trying to bring yourself back into the community in as measured, as gradual, as slow a way as possible, both for the health of your community as well as for your own health.
Thank you.
And Rebecca, Mayor Barrett did just join. If you want to ask your question, then we'll bring it back to him.
Thank you so much. Mayor Barrett, I was asking a question in regards to Cudahy. I understand they pulled out of the agreement that they had with other Milwaukee County municipalities and have decided to end Safer at Home. Your reaction to their pulling out of the agreement and what you think this will mean for Milwaukee moving forward?
Well, Milwaukee, at least from my understanding, Dr. Sajib can talk a little bit about this. He had signed the order yesterday, and we continue to honor that order because we think that, along with the comments that Dr. Weston made, we think that this is good public health. And it appears that some people are following the political winds as opposed to the public health concerns that we have. We still have hundreds of people who are dying. We have thousands of people who are sick. And the fact that there was a 4-3 decision by the state Supreme Court does not change and did not end the pandemic. And I'm not naive enough to think that there are no politics here, but I still am very, very, very concerned about the spikes that could occur. I think we should all be proud that we have done a very credible job here in Wisconsin. If you look at the numbers in Wisconsin, we're doing better than other Midwestern states. But clearly there are political winds that want us to go the other way. And I say all this being very mindful of the fact that businesses want to open. I want them to reopen. But as Dr. Weston was saying, I think that there's an orderly way to do this that will minimize the negative health implications. But again, you're seeing communities that clearly are having decisions that are driven by political considerations as opposed to public health considerations.
So if I may add into that, and thank you, Mayor, and thank you, Dr. Weston, I'll basically echo them. This is the public health decision, and the goal is to reopen the businesses, everybody's interest and understanding. But we have to be very mindful and look into the emerging data and the research that's allowing us to do and look into the subsequent phases. So we have to be very mindful, and really data drives our decisions here. So for Milwaukee's situation, it's definitely still very high risk, and we are still continuing to see high number of cases, but jurisdiction must also follow the public health guidelines and make a judicious decision here. Thank you.
Thank you. And Mayor Barrett, we'll bring it back to you, and then we will still take questions, but I just wanted to give Mayor Barrett a chance to speak, just in general, about your updates.
Sure. Well, again, I thank you all for joining with us today. Some of you might be in your backyards. It's a beautiful day, so congratulations if you're outside. But I think, obviously, the news the last 48 hours has been around the Supreme Court decision, as I said, and the reactions from the different communities. I think what remains to be seen is what is going to be the public health impact of this. Because if we are going to see a lot of people in a lot of congested areas, I think that according to what Dr. Weston has said and other experts have said, we can expect to see an increase in the number of cases. And that's not something that I want to see. I want us to do this in a way that's good for the health of the people in our communities, as well as good for our businesses. And to that end, for example, we've arranged for a webinar tomorrow morning at 11 a.m. for salon owners, for barbershops, so that they have a sense on how to reopen in a fashion that's safe for them and safe for their customers. There was just an article I saw this morning about a barber in New York who was COVID positive, and he had defied the local health orders. And so now the local health experts have to contact all the people that whose hair he had cut over the last several weeks because he's now tested positive. That's exactly what we're trying to avoid. And that's why we want to make sure that to the extent that there is a reopening, that it's done in a very health conscious way. And so that's the next phase for us. But I again, and as I said earlier, I understand where there are political ramifications that are at play right now also.